So before we get started, let's go ahead and label the different parts of the heart. Remember that there's 4 chambers in the heart. The atria sit at the top and the ventricles sit at the bottom. We have the right atrium, the left atrium, the right ventricle, and the left ventricle. Then we have the superior vena cava and inferior vena cava. These are the main veins that deliver the venous blood from the rest of the body back to the heart, specifically the right atrium. Then we have the pulmonary artery, which exits the right ventricle, and we have the aorta, which exits the left ventricle. Now let's talk about the blood flow through the heart. Venous blood from the rest of the body will use the superior vena cava and inferior vena cava to deliver the venous blood back to the heart, specifically the right atrium. Blood will then flow from the right atrium to the right ventricle. Blood will then flow from the right ventricle through the pulmonary artery and enter the pulmonary vasculature. Blood will then exit the pulmonary vasculature using the pulmonary veins and enter the left atrium. Blood will then flow from the left atrium to the left ventricle. Lastly, blood will flow out of the left ventricle through the aorta into the rest of the body. Now that we have a good understanding of the anatomy of the heart as well as blood flow through the heart, we're going to walk through one cardiac cycle. Let's start off with when the heart's in diastole. Diastole is when the heart's at rest or it's relaxed. This will allow for blood to fill the cardiac chambers. When the heart's in diastole, the ventricles are going to be in a low pressure state because they're not squeezing and contracting. This will better allow blood to enter the heart. Remember that the venous blood from the rest of the body will enter the right atrium through the superior vena cava and inferior vena cava. And then blood from the pulmonary vasculature will enter the left atrium using the pulmonary veins. As blood starts to fill up the atria, the atrial pressures are going to increase. Well, eventually those atrial pressures are going to surpass the ventricular pressures. Remember, the ventricles are in a low pressure state because they're relaxed. Once the atrial pressure surpasses the ventricular pressure, the tricuspid valve and mitral valve will open. Remember, the tricuspid valve sits between the right atrium and right ventricle, and the mitral valve sits between the left atrium and left ventricle. Once these valves open, the blood will flow from the atria and start filling up the ventricles because that atrial pressure is higher than the ventricular pressure. So you can see that so far, blood flow has been a result of differences in pressures in the heart. There's been no conduction or contraction taking place. Well, this is where things start to change. As the blood starts to fill up the ventricles, as indicated by the yellow line, the ventricular pressure starts to increase. Well, now the atria need to increase their pressure even more to further push that blood from the atria to the ventricles. And the atria increase their pressure by contracting. And this brings us to the conduction system. In a normal functioning heart, the conduction system starts at the SA node, which sits in the back of the right atrium. The SA node comprises lots of pacemaker cells that have the capability of generating their own cardiac action potentials. Once an action potential is generated by the SA node, it will travel through the right atrium as well as to the left atrium through Bachmann's bundle. And as this action potential travels through the atria, it's going to depolarize the cardiac myocytes or muscle cells. And when these muscle cells become depolarized, they're going to contract. And this contraction will further increase the atrial pressures and further allow blood to flow from the atria to the ventricles. Once the action potential has traveled through the atria, it's going to enter the AV node, which sits at the base of the right atrium. The AV node slows down the conduction velocity. What this does is it allows time for the atria to contract before we depolarize the ventricles, which will lead to ventricular contraction. We don't want both the atria and ventricles contracting at the same time. We need the ventricles to contract after the atria are finished contracting. So that AV node slows down that conduction. As the atria contract and continue to empty their blood into the ventricles, this is going to start to decrease the atrial pressure. In addition to this, the atria begin to repolarize and relax, and this will further decrease the atrial pressure as well. Atrial repolarization occurs at the same time as ventricular depolarization, so let's go back to the conduction system. As the action potential exits the AV node, it will travel through the bundle of His, followed by the right and left bundle branches, followed by the Purkinje fibers. As the action potential travels through this section of the conduction system, it's going to lead to ventricular depolarization. And when the ventricular myocytes or muscle cells depolarize, they're going to contract. This brings us to the next phase of the cardiac cycle known as systole. Systole is when the heart, especially the ventricles, are contracting. This will allow blood to flow through the pulmonary artery and aorta. As the ventricles contract, this is going to further increase that ventricular pressure. Now the ventricular pressure is going to surpass the atrial pressure because the atria are repolarized and relaxed. So as soon as the right ventricular pressure surpasses the right atrial pressure, the tricuspid valve will close. And once the left ventricular pressure surpasses the left atrial pressure, the mitral valve will close. As the ventricular pressure continues to increase, eventually the right ventricular pressure will be greater than the pulmonary arteries and the pulmonic valve will open. Similarly, the left ventricular pressure will eventually be greater than the aorta and the aortic valve will open. As soon as the pulmonic valve and aortic valve open, this is going to allow blood to flow out of the right ventricle through the pulmonary artery and allow blood to flow out of the left ventricle through the aorta. As the blood exits the right and left ventricles, it's going to start to decrease the ventricular pressure. But really what decreases the ventricular pressure is when the ventricles start to repolarize and relax again. Once that right ventricular pressure dips below the pulmonary artery pressure, it's going to close the pulmonic valve. Once the left ventricular pressure decreases below the aortic pressure, it's going to lead to closure of the aortic valve. Once the pulmonic and aortic valves close, we're no longer going to have blood flow exiting the right and left ventricles. This will now bring us back to diastole, where we were at the beginning of the cardiac cycle, in which the heart is in a relaxed state and blood is going to start to fill the cardiac chambers again.